Dr. Stéphane Résimont, welcome. It's an honor and pleasure to have you here on my young podcast, the Chubin podcast. As you know, this podcast has one main aim, to take information from the East to whisper it to the West and vice versa. I'm a great believer that information, especially when it comes to health, has to travel without boundaries, any geographical boundaries or frontiers. And you're at the frontier of functional medicine, and I want to invite you today and thank you for making the time and welcome.
And so, Karim, I'm very happy to participate to this session, because since a long time, I'm very aware of information coming from all over the world. And so, I was using already some therapies coming from Russia and so on since years and years. And so I all the time try to make a mix of all the different possibilities. And so I think that's medicine. It's to stick together many information and do a good medicine with sometimes surprising techniques like the one we're going to develop today. And so I'm very happy to do this session with you.
Thank you, Stéphane. So just a bit of background, Stéphane is an integrative functional medicine practitioner based in Brussels, Belgium. He lectures globally on functional endocrinology and longevity. He's also an ENT surgeon specialist, actually began by being an ENT specialist. And he wears several different caps. So he treats patients he has a main practice in Brussels, but also works in different clinical settings in Brussels and educates and loves to share information. I went to meet Stéphane about a year and a half ago, almost 2 years ago, as a patient, because as many of you know, I had a really bad COVID. And one thing led to the next, and I became his long COVID patient, and then his patient in functional medicine. A friendship grew out of this, and so we've become colleagues. I went and got trained by Stéphane. I don't have the right to use bioidentical hormones as a naturopath in Europe, but it's important to understand hormones as part of the health span, lifespan debate. And it's an indispensable key and clue. And we're opening now a longevity lounge in his office this fall with a main focus on mitochondrial medicine. So this is a little bit of background. Stéphane, the aim of today's first episode is really to understand in a nutshell who you are and how you became a medical doctor and an elite athlete, and how you evolved over the years and became the person you became with an integrative understanding of health and your life mission currently.
Okay, so you used a perfect word which is evolve, and so medicine is that it's evolution. If you stay with what you learned 20, 30, 40 years ago, you lose efficacy and you are dangerous for your patients. And so, one of our patients with what we call long COVID problems told me about HHIT, and this guy is Karim Chubin. And so, as I'm somebody which is very open, it was interesting for me to know what he was talking about and what was this technique. And so I did a test. I sent him a patient, which was very glad. And this is evolution to evolve in your work. You learn new things. You use them if you see that they are working really. And so, I finished medicine in 1985. I was 23 years old, and so I was already writing some articles about taking. How could you? I wrote one on a student. It was about Guillain-Barré illness that could be the consequence of a viral infection, and so we know that actually you have a huge increased number of Guillain-Barré syndrome since the vaccinations to COVID. So there is a link, and so I wrote this paper in a neurological review, very known one, and I did the specialty of ENT, ear, nose, and throat surgery. I was working in cancerology during 3 years, and at the same time I was learning acupuncture in Paris, and then I went to China, Shanghai, to see what they were doing there, and then I learned nutrition, micronutrition, and then I learned hormonology, and so all my life I've been evolving and learning new things, and I put these new things with the other one I knew to make my own medicine. I mean, this integrative medicine, using nutrition, micronutrition, hormonology, but also as I'm a surgeon, I like also to 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 use, the things that are manual things that you can do with your fingers, with your some instruments sometimes, and I try to do something I think integrative medicine, and so with the time. I, I, I learned, I saw that the microbiota, the gut was very important. I'm specialized, very specialized in thyroid. I did until now 136 different conferences about thyroid, hypothyroidism mainly, but sometimes hyperthyroidism with thyroiditis. And also I could see that I could heal completely illness like chronic fatigue syndrome, like fibromyalgia. And how could I do that? Because I was taking care of the mitochondria, and so these mitochondria, it's organoids that we have inside our cells. They are diminishing with age, and also some lots of pathology. I would say nearly all the pathology depends of the function of the mitochondria. Alzheimer's disease, neurological disease like Parkinson, chronic fatigue, and so on and so on. And so I use, of course, food supplements. I use things like CoQ10, PQQ, and so on. But now with what you learn, you brought to me EHHT. I see that I have one thing more I could use to help these patients, and so that's all. With the time, I'm evolving. I'm trying new things, and when they are fine, I use them definitely.
Thank you, Stéphane. So, Stéphane, so you've always been very curious. You're a student of medicine and of life. You're constantly taking on and learning, and then applying it to your practice. And could you explain to me, how did you go from being a medical student, really curious, to being an ENT specialist, to getting interested, because you're also an elite athlete, to actually getting interested in nutrition, to functional endocrinology? Could you explain that journey from being a surgeon, micronutrition, functional endocrinology, to the person you've become and the doctor now?
I don't know. I don't know. I'm just going following the wind. So if I feel the wind pushing me in one direction, I try this direction, and then the wind goes to the other direction. I follow the wind to another the direction, and so it's okay. So feeling.
Correct me if I'm wrong. Weren't you interested in hydration? If I'm not mistaken, when I read your book, you speak a lot about you looking into hydration and electrolytes because you were constantly pushing yourself in, in running. So did your interest in nutrition begin with your interest as an athlete?
Yeah, so I was running and biking long distances, and so I could see that drinking water was made me unable to sustain the training. I was unable to progress. So I thought about electrolytes, and so electrolytes. I thought about nutrition, and then I say, okay, I learned nutrition. So I did it for a few years, and so life makes you, an experience makes you go to this in this direction, and so if you are open minded, you try these directions. So maybe, you know, uh, I think that my colleagues should do the same and not stay on one technique, but open their minds and their brain to use other techniques and to complementary techniques to improve the efficiency of the medicine. And so that it was natural for me. It was natural for me. I didn't force me to do that and that.
But you often told us, I remember when I came for trainings with you, that there is a huge time lapse between what's discovered by scientists in labs and how it's implemented and accepted by conventional wisdom.
I was learning mitochondrial medicine since the end of the 90s. And now in 2020, 22, 23, 24, there are sessions, there are congress. The subject is mitochondrial medicine. And so when I was speaking like the professor Castronovo about mitochondrial medicine 20 years ago, my colleague were looking to me, what is he studying about mitochondria? What is it? What is it for? Why? They didn't understand what we were speaking about. And now it's normal to talk about the mitochondria and the link between the loss of mitochondria and the pathology.
Let me just summarize that right now among physicians in Belgium, and Belgium is at the forefront in Europe of a lot of innovation, just for people out there listening to us today. It's really the sort of North America of Europe in the sense of Belgians are very open as a nation, open-minded and hard. And the thing in mitochondrial medicine now is becoming more and more mainstream. People understanding the importance of understanding health, longevity, through and health span through the prism of mitochondria. That's something that's been missing in functional medicine until very recently.
The medicine I'm doing actually, the medicine I do with hormonology, nutrition, what I do actually, if I was doing this in France, I would be stopped by the authorities because, and you see, all these two countries stick together, France and Belgium, they speak the same language. And so the evolution in France is blocked. And so the problem is that it's not that the States, the US is in advance on what we do, but they are much more open-minded. So if you are open-minded, you are open to, I would say, homeopathy, acupuncture, nutrition, micronutrition. But if you're at the head of the medical board in Belgium or in France, there are stupid people, all doctors that don't progress in their learning. They say what you do is bullshit. Stop this and stop working. And also the problem is that when something is discovered in medicine, it takes between 20 and 20 years to be accepted and used on.
That's very important. So between the discovery and the implementation. And by the way, this is what's fascinating in Russia and in the former Soviet Union, especially. Doctors were often researchers, PhD, like you're a researcher. So they were thinkers and they were implementing, and also the communication between researchers and clinicians were much closer. So they were working like a one large family to serve their patients. They were not working like separate groups with egos and stuff. So that's very. Stefan, also an important point, to give you an example, without going too much into technicalities of the thyroid today, one thing that you fight for a lot is the truth in everything that you do, but you also write to colleagues. Often when patients come to you with their hormonal results coming from different clinicians, and you see that they haven't, looked at reverse T3, they've looked only at the TSH, or they haven't done carried out questionnaires. Do you want to just give a little example there about how a functional practitioner, an integrative one such as yourself, thinks versus a conventional endocrinologist who just uses specific old-fashioned markers, so that people understand this with the thyroid, for example?
Yeah, so I explain. Imagine you have a patient or yourself, you come to see your doctor, and the patient said to the doctor, I have problems. I'm easily cold. I'm fatigued in the morning. I have mood swings. I have constipations. I have hair loss. And the doctor is going to say, oh, wow, this could be hypothyroidism. Yes. He do a blood test. He asks the TSH. TSH is the hormone coming from the hypophyse and hitting the thyroid and say to the thyroid, work. And thyroid say, okay, I like to work. Give me iodine. Give me tyrosine. It's an amino acid coming from the proteins mainly of the morning. And I give you T4. And T4 is inactive. And T4 is going to turn to T3. And so conventional doctor is going to ask in the blood test TSH. And if TSH is in between 0.3 and I would say 4.5, he say you're on the range, everything is fine. And so everything is good. Bye the patient. And the patient is going to say, "Whoa! So why I'm so cold, so fat? So I've got puffy face in the morning. Why do I have constipations?" And so he stay with his complaints, and the doctor say everything is fine because the blood test is fine. This is a huge scandal, because I believe the patient telling I've got this as a problem, and I don't believe the blood test as telling everything is fine. And so a good doctor should ask the T4 maybe, but mainly the T3, the effective one. And in 95% of the cases, with these complaints, the T3 will be too low. And so you have the proof that this patient is effectively in hypothyroidism. But the doctor didn't look to the right dosage, the right thing. It just did of the TSH, but not of the active thyroid hormone.
Stéphane, just to summarize that, this is a really important point. What Stéphane has just said is really, really invaluable. He's saying that most conventional doctors and or endocrinologists will welcome a patient, the patient will complain, will have clinical symptoms, having cold extremities, hands and feet, a puffy face in the morning, brain fog, difficulty losing weight, for example, to name but a few. And the patients are going to complain about, quality of life having dropped. But the doctors, the conventional ones, are going to look at, T4 in the blood. And T4, as we know, is the inactive hormone and needs to be converted to T3. But most doctors don't look at that. They look at that and look at the TSH. And if the TSH falls within a norm, if that TSH falls in, they'll send the patient home saying, you're fine. And the patient will say, hold on a second, I don't feel fine, I don't look fine, yet you're telling me I'm fine. So there's a discrepancy there. The functional integrative practitioner, such as Stéphane, is going to use a completely different set of tools. He's going to ask many, many questions, like a detective. He's going to look at the patient, listen to the patient, He's going to listen to the patient, collect the data, and then look for T3 in the blood, for example, and reverse T3, and look at specific markers, correlate the clinical signs and complain with the results, and get a confirmation, and then treat the patient with effective bioidentical hormones. I mean, if I might want to talk about that or not, and not send the patient home when the patient has complained. And that's really, really very different. So most doctors, unfortunately, are not training enough. And that also applies to naturopaths. We have to remain students of life and students of knowledge and humble in the face of knowledge.
I received in years thousands and thousands of patients coming from different countries. Most of them, not most, but lots of from France, because it's taught to the doctor, you test this, if this is okay, everything is fine. And so, and the medical board, HS in France, say this is the law, you have got to look only to this and don't do anything else. And so many colleagues do bad medicine because they have bad boss above them. And also we are going to speak about it later on, but mitochondria that produce energy, if you have no T3, mitochondria is out, impossible to produce energy.
So this is again very important. Thank you, Stéphane. It's bidirectional. If you have poor mitochondria, you generally also have poor thyroid and other hormones because the mitochondria are present in every cell. But if you've got poor thyroid, you've also got poor mitochondria. So in other words, this is where you can't detach mitochondrial medicine from functional medicine. That's really the message. Is that correct, Stéphane? And and as an athlete, because you're still pushing yourself, I mean, your chronological age is what, 63, but your biological age is much younger. You're constantly challenging yourself and you're using different, so micronutrition, food, training your brain, you're constantly learning, and you're training the muscle that's the brain and the body. So you always say, what's your credo? A muscle that doesn't hurt is that it's like in music, there's no stagnation. You have to.
If you don't feel your muscle because you trained the day before, you did not necessarily training, but you did something physical that make you muscle hurt, you are losing your muscles. After the 45 years old, if you don't feel pain in the muscle, I would not say every day, but nearly every day, it means you are losing your muscles. And it's very important because when you are quite old, for 40, 45, 50, 60, if you lose your muscle, you lose your bones. If you lose your bone, you fall. If you fall, you break your bones. And also it means, and also there is, you be sure that you have lots of other pathologies coming on, because when you lose your muscle mass, lots of things go wrong in your body, in your functions. Yeah.
So what Stéphane has just said here is extremely valuable. In other words, no pain, no gain. It needs to hurt, and you have to challenge the body, and you have to improve allostasis, adaptation in the face of change. Remember, this is really the philosophy. And past 40, you lose bone mass, muscle mass, bone mass, your risk for injuries increase. So you constantly have to challenge your body, your brain, your mind, and soul too. So it's a constant challenge. You can't be static.
But you know, there are lots of publications linking the longevity to the muscle mass. You don't have to be Mr. Muscle, Mr. World, but you need to keep all your life long a certain muscular mass. And as soon I saw that in the hospital, I was working in lots of big hospitals, of university hospitals in Belgium. When you see an old patient over the 50s losing the muscle, you are sure this patient is going to die quite quickly. It's a very good marker of the duration of life.
So when you work out or when you recommend different trainings to patients or to friends, Stefan, are you recommending to combine cardio with muscle building? I mean, it's about changing rotation, correct?
Yeah, yeah. But the only thing is that we when you are aging, if you like, I'm a runner, a long distance runner, but actually I don't run anymore. Nearly just small distances. When you are holding, you hurt quite easily your knees, your hip, and so on. And so running is good, but with the time, with aging, maybe go to the bicycle, go to the steps, go to the to rowing, and so on, and so. But all the time, do a mix of cardio and a mix of musculation, and cardio also take care because too much cardio finally could not be so good. Don't have too much too important muscle mass also because your of course your articulations are quite stiff, but you've got to do a mix. So, but every day do a little cardio, do a little musculation.
Constantly change. Remember cellular surprise, cellular surprise. So it's like with food. You need to constantly rotate and not stick to the same habits to change. And this is very important.
Exactly. Yeah. Change the kind of exercise. Yeah.
Okay, wonderful. And when it comes to hormones, a very important point. So Stefan uses bioidentical hormones, not synthetic hormones, in small dosage, in physiological doses, in concerto, in synergy with nutritional supplements and herbals. So he'll only use hormones if necessary, and he doesn't use it with everyone. And it's very important because he does it in physiological doses to help restore the body's equilibrium. So this is one of the very important markers of aging because hormones give orders to the cell. So we can't, avoid.
Getting old, holding is not only losing the ovaries, losing the testicles, it's also losing the adrenal glands, the thyroid, maybe the hypophyse also, the pancreas. So holding, there are lots of hormones that are impacted by holding. And so, of course, if they are too low, you dysfunction. And when you dysfunction, you go to the pathology.
Stefan, a lot of people out there still think that hormones are scary and dangerous. And if you take hormones, you could potentially develop cancer. What would be your counter argument to that, or how would you explain that to people in just a few lines in today's podcast?
There are two kinds of hormones. The steroids coming from the cholesterol. So cholesterol go to pregnenolone, and pregnenolone goes to cortisol, estradiol, progesterone, testosterone, pregnenolone, and so on, and aldosterone. And there are also the polypeptidic hormones. So there are two kinds of hormones, different. There are different ones. The activity is quite different. The receptors are not the same at the same place, but anyway, it's a detail. And so when if you plan to live until 45, 50, don't take hormones. Go to the cemetery when you're 50. That's finished. But if you are more than 45, 50, you want to have a good life with no disease, to have energy, to have a good libido, a good brain, and so on, then you have got to compensate what you are losing. Of course, you can pray God to say I want to have new testicles, but it doesn't very often work, so I don't believe in it. And so if you have a man of 50 years old or 60, 64 like me with a lack of testo, he's depressed. He loses the brain power. He has no libido. He loses the muscle, the bone mass. He increase drastically the risk of prostate cancer. It increase also the risk of neurodegenerative disease like Alzheimer's disease. And so it's not dopage; it's just giving back to this man what he miss. And the art, what is quite complicated is to do the balance between the physical signs of deficiency, the blood test or the urinary test. And so that's the art of medicine is to have lots of information about the patient, blood test, the complaints, and give him what he needs, and also to give this regarding the other hormones. Of course, for women, for example, if she needs testo, uh, of course, you've got to see, okay, she needs testo, so DHEA testo, but beside this, she needs a good estro. Yes, but beside this, she needs a good progesterone. Yes, but and so it's like an orchestra. You have got to balance all everything perfectly.
Fine, thank you. So Savannah just said something very valuable here. Hormones work like a symphony. It's an orchestra or an orchestra. You have different types of hormones, but hormones have received historically bad press because I'm adding here something due to Premarin and synthetic hormones. But if our aim is to add quality of life to our years and to live beyond 50 and to live well and to age gracefully and to push the limits of aging further down the road because we know that we don't have to age this gracefully, then one of the key elements is to bring hormones made in the lab, but whose molecular structure are identical to the ones produced by our own glands in physiological doses, with a concerto of vitamins, mineral supplements, sleep, hydration, sports, high quality food. So there's a whole, lifestyle there. To, in other words, age the way Stéphane is, which is, in other words, I've seen him, in the gym when we go and train together, not only outperforming me, but outperforming, young, athletic enthusiasts, people who chronologically are 20 years younger, but who, from a biological standpoint, are actually much older. And this could be tested today.
And also, I've got some patients, they come to me to say, okay, I know hormones is important. I would like to balance my hormones. And I say, what did you eat this morning? Well, I eat some piece of bread with cereals, out. So I say, no, stop. First, eat correctly, and then come to me for the hormones after. Because if you don't eat correctly, you have a bad gut flora, and you have toxins going in the bloodstream coming from the gut, and you block your receptor. So the hormone is the last step of the good treatment.
And this is, yeah, it's a last step. This is very important. So you don't just come in and receive hormones, recommended by Stéphane or prescribed by Stéphane and other colleagues of his who think this way. Hormones are messengers and they give an order to the cell. They only come in, later in the process. Food, sleep, there are other key pillars that the patient has to participate. It's like a relationship. It's like a dance. You can't just, lie back and think that it's all going to happen. You have to really sweat in it. And then you gain a lot. You gain when people are decaying, you actually, most of my colleagues now, friends in their mid 40s, have already dropped. And I started 20 years ago, so it's given me a step. And now you have to come in and bring in new elements. So hormones are the last therapeutic measure, and it has to be done well done. Interesting, Stéphane. This is really exciting. And do you feel right now, is it fair to say that you feel in some ways more vibrant and younger than maybe 10 years ago? The more you learn and the more you learn about hormones and other elements.
I would say it's quite stable, since years. I would say the endurance is still there, but the rapidity, the quickness is less than 40 years ago. But I would say when I do a CrossFit or something like this, I have no problem competing with young people of 25, 30 years old.
You've also started martial arts again, no? You started jiu-jitsu, if I'm not mistaken. Again, you've done quite.
Yeah. But I think it's not a good idea because I was a competitor in fighting, judo, boxing, and Brazilian jiu-jitsu, and so it's you hurt yourself. So I think it's not a good idea to go back to this.
You've stopped now, or you're still doing it?
I did a session a few weeks ago, but I was quite destroyed after. So I think I won't do it again.
Once we get the mitochondrial lounge going in Brussels, then you're going to be able to. I think you'll be the first patient on that chair breathing, going up and down. No, but it's going to be quite exciting. Thank you very much for this first thing, and I really for this first episode.
Thank you, Karim. Thank you.